Perfect. So I see that we have many returning members from yesterday's general meeting, as well as a few new ones. So hello, everyone. So for those of you who not previously attended Space 101, this is our Welcome to All Things Space lecture series. These are monthly hour-long webinar series on any topic related to space. So in the past, we have had lectures related to space spin-off technologies and how they benefit medicine on Earth. We've had a guest lecturer. We've had a 12-year-old who was a student at MIT and who is his work is focusing on turning disabilities into hyperabilities in space. We've had Space Shuttle 101. So we've had a very nice mixed varied bag. And as you may have heard, we are currently scheduled through to March 2021 with more lectures on nutrition, on resilience, all across the board. We have immunology in space, life support systems. So we have a really good lineup booked. That being said, if you have a burning desire to present, we certainly would love to have you. So fire me an email. I'll drop my email in the chat. And if we get enough demand, we'll probably go to twice a month for at least some months. So you don't have to wait a whole year to hear your favorite presentation. So without further ado, I will turn it over to today's speaker, who also happens to be our president and CEO, as well as a physician in his day job. So I turn it over to Mike Gallagher to talk about solving problems for medicine on space and in Earth. Mike, take it away.
Sure thing. Thanks so much for the introduction, Shauna, and thank you everyone for taking time on your Sunday to come and listen to me give this talk and everything. It's wonderful to hear that we're booked for a lot of these different lectures up until 2021, and I'm very, very excited to hear all of these different talks and to kind of learn more about each of the domains of knowledge that each of our speakers have kind of fostered over their lives and everything, and because I think it's going to really enrich the knowledge that all of us have, and all of us can then bring to bear on working towards our ultimate goal. So I will just make sure to pull this up now. Can everyone see my screen, and is everyone seeing my slides? And can everyone hear me well?
I don't see your slides yet.
Okay, I'll just wait a moment here. Does it say something to the effect of loading or something like that, or?
I just see you still.
Okay. A mild little technical issue, I guess.
It was loaded before. You may have turned it off, because I did definitely have it on before.
Sure, let me try that one more time. So, okay, so let's go back. I think I see what the problem is. So let's try that one more time. Okay, there we are. Now can you see my screen, and now can you see the slides?
Yes.
That looks good, Michael.
Perfect. That's excellent. And I'll also just maybe turn. Is everyone hearing me as well, loud and clear?
Yes.
Yep. Perfect. Okay. So I'll continue there, and so yeah. So basically, what I'm going to be talking about, as Shauna said, is I'd like to go over a little bit about how space medical problems are solved, and also how that's similar to how we approach patients and solve medical problems in rural environments. So what I want to do over the next, the presentation is going to probably be around 40 minutes, so it'll give us a good time to have a discussion and for you to ask questions and everything. And so, but what I want to talk about are some similarities between space and rural medicine. I mean, there are many aspects of the environments that are different. Space certainly is a more extreme version, but there are a lot of very similar characteristics to both that in fact allow for principles in rural medicine to be applied in space, and also for principles of space medicine to be applied on Earth. And then what I want to do is go over a bit about spaceflight's effects on the human body. And then what I want to do also, and this is to kind of give you a bit of an insight as to kind of how doctors think and why we think that way. I want to just go over how extraordinarily complicated the human body is. And then from that, I'm going to go over to how medical professionals tend to deal with that complexity today and how they dealt with it in the past. And then what I'd also like to do is I would like to kind of go over a bit of what our organization is trying to do to develop technologies that might be able to start to solve additional problems related to space medicine and also rural medicine, and just why we maybe need some of those new tools in the toolbox and everything. So a bit about me. Sean did a wonderful introduction. So I am a family doctor by background. I was trained in rural residency, so I spent a lot of time in small towns in Canada and in the province of Alberta, and then also up in Yellowknife. I also am an assistant clinical professor at the University of Alberta. Currently, my day job is very much at the Canadian Forces Base, though I still do work in the hospital and occasionally will do rural locums. I was in the Yukon last year. And but as part of that, I've been very fortunate through the Canadian Forces to obtain their advanced dive medicine qualifications. So I can certify their combat divers, and it's a really another very unique area of medicine where you start to get into this theme of how do you care for healthy people in extreme environments. And that also is an interesting component of space medicine. In terms of space medicine qualifications, I'm not a NASA flight surgeon. I'm not a CSA flight surgeon. I don't have the aeromedical qualification through the Canadian Forces, but I did complete the University of Texas Medical Branch's Principles of Aviation and Space Medicine short course. And that's the same one that a number of the European Space Agency flight surgeons also complete. The other thing way back in 2010 that I did was a 1-month elective in aerospace medicine at the Kennedy Space Center in Cape Canaveral, Florida. Way back, I got a Bachelor of Science with honors in life sciences with a subject of specialization. So when I kind of go into a bit of the complexity of the human body, that kind of goes back to some of my studies then. So I'll show you a few pictures of this elective, because I mean, for me, it was a really formative part of my life, and one of those moments where I kind of say, I really want to have space a bit more in my life going forward. And I think before that, I really didn't think that was all that possible, being, medical student in Canada. And I wanted to figure out, how do we figure out how to